Crystal Chiropractic brings you another segment of Did You Know with Dr. Larry.
How much is too much? I've often asked myself that question, as I'm sure all of you had for various things. For example, when it comes to firewood, can any of us have too much? Maybe, but for the most part, many of us try to err on the side of having enough to get through a long winter, because a cold house in March isn't much fun. How about gas prices? Remember $4 a gallon? That was a little much. Or how about propane prices last year? Now that was way too much. See, sometimes we're in control of how much we need of something, and sometimes we're not. But the challenge is to know when how much of something becomes too much. So in my line of work, when it comes to chiropractic care, how much chiropractic is too much? 3 visits or 30? 3 days of care or 300? 3 times per week or 3 times per year? And how can you, the patient, even know? The answer is you can't, because you're not a chiropractor. And so therefore, you leave that up to us to determine. But like you, I never liked that, because the system is set up so that more often you come in, the more we get paid, which means this: there's less incentive to get you and your condition treated quicker, better, or faster, which can mean longer treatment plans, causing more copays, and you guessed it, too much chiropractic. So without being a chiropractor, how can you know when it's been too much? I know I said earlier that you can't know, but there is an exception. And here it is. In my office, every patient develops the confidence to know that at the end of any visit, if that was the last one, or if another one is needed to fix the problem. Meaning this: each and every visit is done as needed, and the next one is determined by you, the patient. It's that simple, and most important, it's never too much.
Did You Know has been brought to you by Crystal Chiropractic.